Would you call someone a failure because they have asthma? Or a diabetic a failure because their pancreas cannot produce insulin? No. So why do we do obesity that way? Why do we call obesity a failure when someone can't do an organic process? Other diseases we don't treat that way. So why are we doing obesity? I'm Dr. Newman, and today I want to talk to you about something that is costing lives, breeding shame, and delaying healing, and that's obesity. We're really going to talk about the truth of obesity. The Bible says people perish because of the lack of knowledge, and that's what this conversation is about, bringing knowledge so that we can reduce the shame and promote healing. Obesity is not just a matter of willpower or laziness, which is why in 2013, the American Medical Association recognized obesity as a chronic disease, which means it has an identifiable cause, known progression, and requires medical attention, not moral judgment. So let's get into the boring stuff, but the most important stuff, the knowledge. Research shows that obesity affects the brain's hunger and reward system. It is involved in metabolism, hormones, and even your fat cells get involved. And they all act like the endocrine system, where it really becomes a part of the endocrine system, which really regulates your hormones. That's what the endocrine system does. One study that was published in the Nature's Review of Endocrinology showed that obesity dysregulates your appetite, increases your insulin resistance, and is a chronic inflammatory state. And this chronic inflammatory state is really what leads to the terminal diseases of obesity, because your organs remain inflamed for too long, which then causes them to not work right because they harden and all kinds of stuff. So because of this knowledge, because we know this, what has happened is those societies like Obesity Society and Endocrine Society has really said the treatment for obesity is a long-term treatment that involves behavioral interventions, nutritional changes, and you got it, medications, just like we do any other chronic disease. High blood pressure requires diabetes, lifestyle management and medications, asthma, lifestyle management medications. So obesity falls into the same category because it is a chronic disease. So why has it been a problem this whole time? Well, it's because we've been sold a bill of rights. We've been sold a lie. We thought that eating less, moving more, you'll be happy, you'll lose your weight. This messaging, while not necessarily completely wrong, it has some truth to it. It was not comprehensive enough. It did not provide a full treatment plan. And because of this, we have over time harmed several people by creating a culture of shame and bias around weight management. This culture has made people feel like they're a failure if they regain the weight after they failed a fat diet. Medications seem to be like you're cheating because you're not really doing the proper treatment. And worst of all, patients delay getting real care because they believe it's just something wrong with them. I have a problem. But I'm here to tell you, you are not broken. You have a disease. And if you go get treatment for your disease, just like any other disease, you'd be fine. And what's scary for me is that not treating obesity because of these stigmas, because of the cultural shame, is really killing people, because obesity is the number one risk factor for diabetes, for heart disease, for sleep apnea, and more. And these risk factors make those other chronic diseases worse and increases your rate of morbidity and mortality if you have the combination. So the truth is, obesity is a disease, and therefore it requires more than just motivation and changing your diet and physically exercising. It really does require medicine. When we say treating obesity as a disease, what we mean is that we have to have an approach that is compassionate and understanding. We have to understand that you may need a medication. The GLP-1s are groundbreaking. They're really changing. They have changed people's lives. And so it's okay to use the GLP-1s like Ozempic, semaglutide, tirzepatide to help regulate your hunger hormones and insulin sensitivity. It also means tracking the body composition, not the BMI, not just the weight, because muscle is heavier. And if you're exercising to lose weight and get healthy and treat your obesity, then you're going to build muscle. It also means supporting behavior things like sleep and stress and emotional and mental coping, and getting to the bottom of some of your bad coping mechanisms. And it means true long-term care, not a 30-day fad, not something that's not sustainable. Sometimes it's okay to do intermittent fasting, but is that something that's sustainable for your lifestyle? It really is a tailored treatment, just like any other disease process. There's no difference in treating obesity as a chronic illness, just like we treat hypertension, depression, and all kind of other things, all kind of other chronic illnesses, with medication and lifestyle changes and support from healthy people who have your back, like me, Dr. Newman. So let me be clear, because I'm Dr. Newman, you're a doctor in the family. If you are struggling with obesity, the disease called obesity, you are not a failure. You are worth everything that you've been struggling with. You are worth getting back on the horse. You are worth trying it again for the 100th time. You are worth it all. And you deserve proper treatment for your chronic disease. I'm sorry that you've been ignored, dismissed, or misdiagnosed for a long time, but you are living with the chronic disease and you deserve real quick care. You deserve a real treatment plan, not just a guilt trip or made to feel shame because you're using medicine. And if someone tells you that medicine is the easy way out, first of all, ignore them. But remind them that we treat other chronic diseases like diabetes with insulin and hypertension with high blood pressure medication so that we can save people's lives. And that's part of the tool to make sure that people are thriving. So choose treatment. And choosing it is not weakness, it's actually wisdom. It's the other W. And so if someone tries to shame you for using medication, you tell them you're choosing wisdom, not weakness. And if this message resonates with you, please share it with someone else who may be having the same struggle of feeling like they're being shamed for using the medication, or they feel judged for not losing weight or following the latest trend. And let's rewrite this narrative about obesity and weight management into the true narrative. Let's normalize true treatment for obesity with science, compassion, and truth. And of course, if you're ready to take the next step, we have the Life Med Journey, where we combine lifestyle and medication that we've just talked about to make sure you're on this journey healthy. And I'm here to help. Give me a call, follow me on social media, go over to our website, book an appointment, all the things. Because when you know better, you do better. And healing starts with knowledge and wisdom.